Um, so yes, I'm involved in very many different ways in getting people to be involved in my first priority is research, but I also work in other fields at local level and at national level, trying to recruit people to various studies or at local authority level to be involved with representing public views. And it's a tough ask. So I would start by saying recruiting people with dementia and possibly their carers, is not going to be easy at the best of times, whether it's for health research or social care research. And I would slightly differentiate because, say, well, let me go on to my next slide. I'm going to refer to two major projects just to cut my talk down, really, because I haven't got very long, and I'm sure you're looking forward to your break. But I was a co-investigator. Well, I am a co-investigator on Determined, which is a major project. I'll just let me see what you're seeing on the screen. That's fine. Whoops, sorry. Back we go. It's a major dementia project over now 5 years. It was 4 years originally, but extended due to COVID. And we're looking at the quality of life and cost of care and the inequalities in that. So that's a major project recruiting over 900 people and their carers. And I'm not going to talk about the actual participants of the research. I'm going to concentrate on, which is my role, of getting together people
2
with
seconds, Anna.
dementia and carers. Yes? Sorry, I heard a voice come in there. I'm going to concentrate on the development of a reference group for Determined and also for the preceding MODEM project. And Determined followed on from the excess of MODEM, which started in 2014, a 4-year project, and that was involving 300 people with dementia and their carers. And in both cases, these patients were recruited from secondary care. So the actual people that were involved in the research with dementia were recruited mainly from secondary care. And that's different to my role, which is getting people from the wider community to be part of a reference group. And those reference groups, and I'll go on to the next stage, their role is really to come together with researchers throughout the length of the project at various stages, perhaps when preliminary findings are ready for discussion, and also at the end of the project. And so we come together and we discuss the output from the research at the date of reporting. And it's extremely useful to the research team members to have this feedback from lived experience. So that is the role of the reference groups. And obviously, there are other ways in which people can be involved in advisory groups where they perhaps only meet very occasionally with other people from different constituencies. So say it might be a senior member from the Alzheimer's Society or the King's Fund or whichever organisations are relevant. But the reference groups are, the core membership is people with dementia and carers. Now, MODEM, we met about twice a year at the LSE. And you do find that over time, it's a real benefit to the members of the group to come together and they really develop a sense of community. And when you meet face to face within these groups, as I'm sure you must find with your groups of public involvement at Brighton, they get to know each other, and also the professionals and the researchers have a chance to not build up a relationship, but get to know the individuals. And so there's that opportunity for free exchange of ideas and comment and debate. Now, with Determined, the problem was that COVID came really just after we started, and I think we only just met twice. And then we had to go online, and that isn't so personal. I mean, it was, what shall I say, opportune that digital, Zoom, the platforms, Teams, etc., have advanced so rapidly during COVID and enabled this form of communication. But even so, it wasn't so personal, and didn't have that benefit of developing a community and having informal discussions between the members of the research team, which we might have had over lunch, etc., and in general conversation after the meeting, just as you get at face-to-face conferences. But we are meeting up at the LSE in July for our first meeting, really, for quite a long time. Now, these groups are they're so important to the researchers, and I'll show you my next slide. Oh, I didn't really didn't mention my personal background. I am a past carer for my husband and both my mother, who had dementia. So I was a carer for 20 years. And I really couldn't carry out this role without this connection, both with lived experience. And also I'm very much involved at national and local level with dementia organisations, and particular one at local level where we provide respite care for carers looking after people from really cradle to grave, but quite a few of our members are carers of people with dementia. And I have facilitated a peer support group for carers of people with dementia at our local, what we call a caring cafe, a meeting place for people with dementia and carers, for over 12 years. And I've learned so much from that, and also recruited from my group and the wider local population. But of course, when you're trying to have diversity on the group, it's quite difficult to reach out to a wider community, people that are perhaps not thinking about being involved in research, particularly when they have dementia, and carers. Now, I know from my experience over the years that everybody with dementia and every carer are very different. Whether you have Alzheimer's or another form of dementia. I know my husband and my mother had very, very different personalities behind their dementia, and only quite a small minority, I would say, really, of people with dementia are interested in being involved with research. I expect some of you here are thinking, oh, that's not quite true, because you have recruited people through secondary care, and there you have an audience that is already selected. But when you go out into the community to look more broadly, to bring in people with different life's experience from really the social care environment, and that's where I work, being part of LSE, the Care Policy Evaluation Unit, and that we focus on social care research rather than health research. When you're going for that wider community, it's a lot more difficult. But nevertheless, um, we managed to recruit our membership, and they become a very loyal membership. And in fact, they really benefit from being involved. So I've recruited, as I said, for both Modem and Determined. Both these projects were led by Professor Shubi Banerjee, who was at Brighton for Modem, and now he's moved on to Portsmouth, as you know. And also for various sub-studies, because they're such large research projects that we have several sub-studies attached to the research, where the patients that have been recruited for Determined, say, are recruited to much smaller research studies. So what are the challenges of recruiting and the sustaining people for advisory or reference groups? If you're working with patients, as I've already mentioned, trying to recruit from a population coming from more diverse communities, it creates its own difficulties, but we do our best. Researchers sorry, I've gone on to my next slide. Lack of interest in involvement with people who may or may not have insight into their dementia, and their carers who are already coping with their new and advancing caring role. So as I've already said, it's a pretty difficult job, but something I enjoy. And because I have the connections I do, it makes it somewhat easier. And also, I must say, I'm slightly selective as to, it's inevitable that people I think might be involved, might like to be involved, then I will obviously invite them. You have to give sufficient support and opportunities for people. This is a reference group of users and carers. That's what RGUC means. Input into the research project as it progresses. And this is difficult because you're all such busy people as professionals or researchers, and you're beavering away with your research, and we don't hear anything more, and I have to say, how are you getting on, and try and sort of give a progress report to my reference group members, and keep them involved, because if you sort of let your connection with your these patients who are involved with your research project, and they don't hear anything from you for a while on one of these long-term projects, they really will lose interest and think they're not very, very valued as individuals. And then, of course, with dementia, and particularly with long-term projects, 4 or 5 years, as the projects I have mentioned, have been, that's the extent of the length of the projects. Obviously, the dementia symptoms change, and the role of the carer changes with the changing demands on them. And so inevitably, some people aren't able to continue. And so there's a constant need for recruitment, or in any long-term group you have. And now I did mention about during COVID, moving from face-to-face meetings to online meetings. And I think that's quite an important issue for people to recognize. And it's like working from home. It's the same issues, really, that if people aren't meeting together, you're not developing that sort of community environment, and have an opportunity for the informal interactions, which is so important. When we were at the LSE and people used to come up for Modem meetings, say, for example, we used to meet for coffee in the morning. that is the members of the reference group. Then we'd meet the team over lunch, and then we'd have our own meeting in the afternoon, or a mixed meeting with researchers. So that created a whole community, and we became very close over the years. While with Determined, I communicate with the reference group and keep in touch with them, and they're a really loyal bunch. But it's been quite a difficult time for them during COVID, really, to sustain interest. And the research project was extended because of COVID and issues around recruitment of patients for the study. So I must say, I take my hat off to them. And I think when you have people involved in research, all I can say is you really need to look after them. They have tough lives, people with dementia, and the carers. And if they are willing to be involved with research, then just welcome them with open arms. Well, I think that's more or less the end. So I've just said benefits of people with dementia and their carers. Well, it really is the benefits of having them there. It grounds discussions with researchers in reality and helps to keep the person-centered perspective within the research project. And the researchers communicating and debating with people who have lived experience of dementia as the project advances. I find that, and I'm sure they recognize it themselves, they look at the outcomes of the project with a more informed and critical eye and see opportunities within the research. Sometimes it sort of just tweaks it in a way to perhaps look at different measurements, etc. So it's really valuable. That's if you haven't been involved with patients in research up till now, then, well, I'm sure you must have done in some ways, but it's really worthwhile having those informal opportunities outside perhaps the particular research questioning. And then being prepared to communicate and required to communicate with the lay members of the reference group during the project provides practical opportunities, particularly for young researchers, to develop and improve the clarity of their presentation of research material. And if I can say anything over the time I've been working in research, I found it when first we had researchers joining with our reference group members and reporting on their research. It was just way above the reference group members' heads and my own, because I'm not a researcher as such. I come from a nursing professional background in the NHS. And but over the years, our communication, the communication of researchers has really become much more grounded. And that's a very important part, of course, of any research project, how you communicate with the interested readers of your research projects. And that's where I finish.